Thank you very much. Since this is my last talk at the conference, I just wanted to take a moment to thank you all for your gracious hospitality. I've really enjoyed my time here in Pune. It's my first MOACON meeting, and I've learned a tremendous amount, so thank you very much. I'm going to be talking about 3D printing and hip preservation surgery today. After that heated debate last night, I think Parag sir had a very good conclusion saying that there should be a marriage between technology and surgical skill. Hopefully the KHS team out there won't think of me as a fool with a cool new tool, but hopefully you'll see how 3D prints have helped my practice. So the importance of patient-specific 3D prints come in these different varieties. So primarily for patient care, so all of us always put the patient first, so important for preoperative planning and to develop patient-specific implants. Also for education, not just of the patient and the family, but also for our residents and trainees to learn how to do some of these complex procedures, as well as for research, which I'll show you, and obviously for marketing to increase our patient volumes. So recent studies in 3D prints in orthopedics have looked at using it in congenital scoliosis to decrease operative time, in excising complex pelvic chondrosarcomas, as well as to do some three-dimensional distal radius osteotomies. I'm going to be talking about two studies which we recently published, this one in Journal of Children's Orthopedics, to look at 3D models for performing a Imhauser three-plane osteotomy. So for those of you who might not be familiar with slip capital-femoral epiphysis, it's a very common adolescent hip disorder, causes a complex three-dimensional deformity. And Southwick was the first to describe this three-plane osteotomy, resulting in flexion, valgus, and internal rotation. So the purpose of this study was to see how the 3D prints could help us in the surgery, and we hypothesized that it would decrease surgical time, fluoroscopy time, as well as improve correction. So it was a single institution study. I had 3 cohorts, patients I had treated without the models, patients I had treated with the models, as well as patients from my senior partners that were done previously. So this is the simple tabletop printer that we have, LuzBolt, nothing too complicated. But that's how it prints a 3D rendering of a proximal femoral deformity. So after creating the model, we would perform a mock surgery as shown in the lower images, and then use that technique as well as the amount of bone resected to help during the actual surgical procedure. So here's some preoperative measures just showing that the groups weren't significantly different. Only one variable, the articular trochanteric distance, was slightly different. Intraoperative measures showing that we significantly decreased surgical time, not just between me with and without the model, but also compared to my senior colleagues, as well as decreased the fluoroscopy time with no changes in blood loss. An interesting finding is that there were no differences in postoperative radiographic measures, so not saying that I'm getting a better correction, just that I'm getting that same correction that my senior colleagues could get in a shorter time with less radiation exposure to the patient. Also, there were complications in the other 2 groups, including an implant failure that's shown there, as well as a malpositioned implant that required revision. So once the models were performed, we didn't have any of these complications. So obviously there's low sample size, there's no prospective control of my own group without the model, and variable follow-up in the 3 cohorts. But this is some of the initial work that shows that 3D printing can improve surgical outcomes for our patients. This is another study showing how 3D prints can be used for research. So we studied acetabular dysplasia in 3 commonly performed pelvic osteotomies. And the purpose of this was to see how those 3 osteotomies differ and result in different radiographic correction. So just so we're all on the same page, the 3 most common procedures performed for acetabular dysplasia in children include the Dega, the Pemberton, and San Diego. So from the outside view, they all look pretty similar, but the inner view, the medial wall of the ilium, is very different. As you can see, the Dega stops 1 centimeter short of the sciatic notch. The Pemberton curves down to the posterior limb of the triradiate cartilage, and the San Diego leaves that entire medial ilium hinge to allow for the correction. So the unique thing with this study was that we got a dual nozzle extruder for our 3D printer, so we could print with 2 different materials within the same model. So this soft NinjaFlex material allowed us to replicate cartilage. So we printed it into the triradiate cartilage as well as the pubic symphysis. So you'll see some pictures here. That second material is the beige color, and the primary plastic is the blue cover. So the unique thing here is that we could print patient-specific pelvi, so print 3 copies of the same pelvis perform the 3 different surgeries on that pelvis, and see what type of correction we can get. And that was assessed with that 3D CT analysis, which I talked about previously. Basically, it showed that the 3 different types of osteotomies result in 3 different types of correction. So it's not that the surgeon should just learn one technique and do it on everybody, because different patients would need different types of coverage. So it's really important to customize your surgery to treat the patient that's in front of you. So basically, we found that the 3 different types of osteotomies resulted in significantly different coverage angles, with the Pemberton and Dega giving more anterior coverage and the San Diego giving more posterior coverage. So we know that classic dysplasia doesn't just result in anterior undercoverage, and so you have to, again, customize your surgery for your specific patient. This study also showed a similar decrease in volume. So there's a lot of controversy in the pediatric community about whether these surgeries actually affect acetabular volume. So with these models, we were able to show that volume is decreased. However, it's decreased similarly between the 3 different osteotomies. So finally, I wanted to talk about some of these complex cases that we used it for. So this is a 17-month-old female that came in with hip pain, refusal to bear weight. You can see her exam and inflammatory markers. So very clear picture for an infection. Here's her radiographs and her MRI showing a left-sided septic hip as well as femoral osteomyelitis, as well as significant myositis in the muscles. So she had MRSA bacteremia and MRSA femoral osteomyelitis and a septic hip. So very sick patient and aggressive disease, which was treated aggressively with surgery, irrigation debridement of the hip and femur 4 times, as well as IV antibiotics and orals for 2 additional months. So these are just some of the radiographs during her treatment. Finally, in September, she started to clear her infection. Her CRP was starting to improve. However, by November, you can see she had pathologic fracture, significant involvement of the entire femoral canal. And by the time she was 21 months old, we had cured her osteomyelitis. However, she had this terrible, malunited, deformed femur that can be seen with the CT scan. So retroversion at the proximal portion, significant varus at the head-neck junction, and deformity in the shaft. So how would this patient be treated? Of course, you could observe, let God do its work and see what the natural history would be. But here's the 3D CT femur. And so we decided to preoperatively print the femur. So you can see here the pelvis as well as the contralateral hip printed, the deformed femur, trying to figure out if there's any type of surgical procedures we can do to improve the anatomy, improve the biomechanics. And then actually customized a little metacarpal plate, so from the modular hand tray, to fit this 21-month-old femur. And once it was customized for our model, we could sterilize the plate and take it into surgery with us. So here's the patient immediately post-operatively, and then at 2 months and 1 year follow-up after the implants have been removed. So you can see significant biomechanical correction of that proximal femur as well as resolution of the infection. Finally, this is another patient, a 15-year-old nationally recognized motocross rider who presented with a complex right proximal hip deformity, likely due to residual Perthes. So at 18 years old, you can see the MRI looks relatively normal. That's a physiologic cleft in the labrum, so no labral tears. And this 3D proximal femoral deformity, which you can clearly see on the CT scan. So for a patient like this, there's lots of different approaches. So 3 possible surgeries that you can do on them was a valgus femoral osteotomy. You could do this Morsher procedure, which is a femoral neck lengthening, as well as the intertrochanteric osteotomy, or a surgical dislocation with the femoral head reduction osteotomy. So we were able to print his anatomy, perform these 3 or 4 different surgical options on them, and see how we're best able to reconstruct to a more normal anatomy. So we chose to proceed with the Morsher osteotomy, which is shown here, 4-part proximal femoral osteotomy. And once the surgery was performed, you can see these correction followed by 4 months, 6 months, and finally 8 months after surgery and after removal. So significant correction of his mechanics. So in summary, I think 3D prints really aid in surgical planning and understanding complex deformity. I'm not saying just because you have this cool tool, it would make you a better surgeon, but I think it can really amplify your surgical skills. I think it's an additional tool that a lot of surgeons are already starting to have in their armamentarium here. It's low cost, I guess relatively low cost, $2,200 in the US, But the important thing is that the material costs are very low, $5 to $10 for every print. And then I think it's a useful tool to overcome a complex learning curve to allow for simulation training for your residents and fellows. So hopefully I've shown that 3D printing can provide a beautiful marriage between technology and surgical skill, and hopefully it won't end up like this one. Thank you very much for your time.